Before I start, I want to tell a story. So yesterday I visited Prague Castle, and the buildings there were built in the 15th century, and I was amazed by the architecture. I couldn't believe it. And even though there's been some structural damage over the years to some of the buildings, they're still standing and they're phenomenal. And even the art is phenomenal, and some of it's a little gaudy. There's a lot of silver going on, but it's amazing. And I kept thinking, okay, so this was in the 15th century. So I had one thought going on was, if this happened back then in the 1400s, how come they didn't figure out plumbing and electricity sooner? And the other thought I had going on was, why are we where we are today with cancer in the 21st century? Why are we so far behind? And that's sort of the basis of my whole talk, because I wanted to make it broader than liver cancer, though I will talk about that. I wanted to talk about why we need to choose to cure cancer, because I really think it's a conscious decision. As our moderator said, I am the president and founder of Blue Fairy, which is an international nonprofit organization, and I'm also the co-founder and CEO of Cancer University, which is a national for-profit social benefit company. So I wanted to begin with this quote from President John F. Kennedy. This was in September 1962, and he was urging Americans to share his vision of going to the moon. There is no strife, no prejudice, no national conflict in outer space as yet. Its hazards are hostile to us all. Its conquest deserves the best of all mankind, and its opportunity for peaceful cooperation may never come again. But why, some say, the moon? Why choose this as our goal? And they may well ask, why climb the highest mountain? Why 35 years ago fly the Atlantic? Why does Rice play Texas? And you don't get that joke unless you understand college football in the U.S. We choose to go to the moon. So I want you to remember that last part. We choose to go to the moon, because I'm going to come back to those words. So I know these stats won't surprise you guys. In 2018, there were 18 million new cancer cases worldwide and 9.6 million cancer deaths worldwide, making cancer the second leading cause of death worldwide. And in the U.S., almost 50 years ago, President Nixon signed the National Cancer Act, and he declared war on cancer. And in fact, it was called Nixon's War on Cancer. And in the U.S., the number of survivors has increased from 3 million in 1971 to 12 million in 2007. But globally, there are approximately 42 million people worldwide living with cancer at any given time. And that number has more than doubled since 1990, when there are estimated 19 million people had cancer. And as you can see on this map, the US and China have the most people living with cancer, followed by India. And with China and India, you could say, well, that makes sense with population. And the US has the third largest population in the world, but it's significantly lower than China and India. So if you adjust for population, the U.S. has probably the largest number of people with cancer at any given time. So now I want to share with you why I am so crazy passionate about finding a cure for cancer. As I mentioned in the opening, I'm founder of Blue Fairy, the Adrian Wilson Liver Cancer Association, an international NGO based in Los Angeles, California. And I started Blue Fairy in memory of my sister Adrian, who died from HCC at the age of 15. And people always ask, well, how did you come up with the name? And Adrian loved fairies, and her favorite color was blue. And when she was diagnosed with HCC, she had blue hair, which you're going to see on the very next slide. And after starting chemo, she asked for a blue wig to maintain her look, as she called it. And then she bought these blue butterfly wings. And that summer when she was sick, we began calling her our Blue Fairy. So that's where the name came from. And we spell it with an E because that's the way she liked it. So there she is with her natural blue hair the summer before she was sick. And I don't know if you have sisters, but I think this is one of the best quotes about sisters ever. Children leave you, so do husbands and lovers, but your sisters, they're the only ones with you from crib till death. But Adrienne was more than my sister. She was my child and best friend. Her father died before she was born. A 2-week Christmas vacation to visit me in Los Angeles turned into a permanent stay when our mother decided she didn't want to be a mother anymore. And I was 22 years old when I became my sister's guardian. I raised Adrienne from the time she was 8 years old until she died in my arms at age 15 from stage 4 liver cancer. And here is Adrienne during her cancer journey. She's showing off her quad hawk, her idea, at Children's Hospital Los Angeles. In the middle there, she's meeting her favorite musician, Dave Navarro from Jane's Addiction, at the Tonight Show, where we also met Jay Leno. And on the far right, there she is standing outside of a restaurant during her Make-A-Wish day, which also included Dave Navarro. And that was Adrienne's favorite photo of herself because she thought she looked like an elegant mannequin. And I like to say that Adrienne and I created the very first selfie ever in 1995 with my 35mm camera. And with our 14-year age difference, I was not supposed to outlive Adrienne. It's just not the way things were supposed to happen. Adrienne died on October 9th, 2001 in Burbank, California at 7 p.m. in her bed surrounded by people who loved her. And her last words were, "I love you, sissy." So 1 year later, I decided I had to find a way to channel my grief. And I approached the largest liver disease nonprofit in the U.S., I will not say who they are, and offered to create a liver cancer program for them. But they said, we don't do liver cancer. So thus, Blue Fairy was born. Our mission is to prevent, treat, and cure primary liver cancer, specifically hepatocellular carcinoma, through research, education, and advocacy. And with only $500 to cover the cost of the federal filing fee, we raised money by running marathons over the years and even jumping off platforms. And this is me on the far left doing the Las Vegas Marathon. I actually did a total of 6 marathons and 1 half marathon. We developed 3 core programs. Our HCC patient education brochures are free to patients, their families, and our healthcare providers. And we actually ship anywhere in the world as long as we have a valid address. Our brochures have been translated into Spanish and Chinese. They've been distributed in over 40 treatment centers in the U.S., and they've been shipped to China, Armenia, and Nigeria. Our Blue Fairy Award for Excellence in Liver Cancer Research acknowledges its doctor or scientist doing really exceptional and innovative research in HCC, and that award is given on Adrienne's birthday, which is April 8th. So that award period actually just closed on January 31st. And this year we're really excited to be giving the award out to someone outside the U.S. And our Adrienne Wilson Spirit Award is actually for HCC patients who advocate for themselves and others during their cancer journey. And the award was inspired by this woman here in the green wig, Kathy Bryson, who lost her second battle with liver cancer in 2010. Kathy was a nurse. It was her lifelong career, and she got hepatitis C due to a needle stick at the hospital. And that's how she ended up developing liver cancer. And I'd like you to meet our medical research committee chairs over the years. Dr. Sherry Rose from 2003 to 2010. She is now an associate professor at Harvard. Doug Senegal from 2010 to 2015. He's now the senior director of medical affairs at Blue Earth Diagnostics. Formerly, he was with Surtex and Bayer. And now Dr. Ghassan Abu Alfa, a very well-known oncologist who practices at Sloan Kettering and who specializes in HCC. Our board of directors have diverse backgrounds and talents and live in 5 different states. And we keep our overhead very low by having 2 virtual offices and using technology to conduct our board business. And a combination of PhDs, MDs, MBAs, and certified physician's assistants, our medical advisory board represents a broad range of disciplines and people, all of whom are dedicated to HCC. And for 10 years, we really operated under the radar. No one paid attention to us, except for the HCC doctors who requested our brochures, the patients who found us online and needed our help, and the individual donors who supported and believed in our mission. And in 2013, that all changed when I was invited to attend the first ever liver cancer roundtable in Washington, D.C. Because around that time is when liver cancer really started increasing in the U.S. and people started paying attention. From that point forward, Blue Fairy has been recognized as the leading HCC patient organization in the U.S. And not only do we attend multiple conferences and events every year, but I've been asked to speak on behalf of HCC patients and caregivers and tell my sister's story at universities, conferences, and the government, including the FDA and the Department of Defense. In the far right in the top corner there, I recorded my sister's story at StoryCorps in Chicago. The bottom left, this is at the American Society of Clinical Oncology, or ASCO's annual meeting. Highly recommend it if you've never been. It's insane. It's over 40,000 people. We have a booth there every year now. And on the bottom right, I was honored to be an e-patient scholar at Stanford Medicine X. In October 2017, we launched our safe, private, HIPAA-compliant liver cancer community for HCC patients and caregivers. And we have two amazing community ambassadors who moderate the forum. Azure Klein, her father died from HCC in 2017, and Kathy Anderson, her husband died from HCC in 2003. And what's interesting about this community is for every one patient who signs up, 2 caregivers who sign up. So caregivers really do the bulk of the research for the patients. It's important to address their needs as well. Blue Fairy celebrated 15 years in December 2017. And that same year, I launched the Better Off Bald podcast, which is based on my unpublished memoir of raising and losing my sister to liver cancer in only 147 days. And you can find the podcast on iTunes. If you just look on iTunes, Better Off Bald, or on Stitcher, or wherever you listen to podcasts if you do. And we don't like to reinvent the wheel. So if someone is providing a service that we don't, we want to work with them. So last year we partnered with Pethura and Imerman Angels. And with Pethura, we provide HCC patients with a precision cancer analysis report. And with Imerman Angels, they get one-on-one peer support. Less than 2 years ago, we overhauled our website and intentionally focused on the HCC patient population by translating the site into Arabic, Chinese, Japanese, Korean, Portuguese, Spanish, and Vietnamese. We added Urdu, Hindi, and Mongolian over the past few years, Mongolian just recently, due to numerous requests from doctors at conferences. And this is a snapshot of our 2018 internet traffic. And while most people coming to our website are from English-speaking countries, we consistently get traffic from India, China, and Korea. This map shows the overall 5-year survival rate of liver cancer as of 2009. All the countries shaded dark green had a survival rate of 17.5% or above, with Japan having the highest at 27%. They are definitely doing something better than the rest of us. The current overall 5-year survival rate of liver cancer in the U.S. is 18%. I mean, that's as of this past year. But if a patient is diagnosed in stage 4, like my sister and like so many patients I speak to, the current 5-year survival rate in the U.S. is 3%, which is exactly what it was in 2001. It has not gotten better at all. That's not acceptable. And after a 10-year drought with only sorafenib available to advanced stage HCC patients, 5 drugs have been approved over 2 years. But 2 of those drugs, Opdivo and Keytruda, are for second line only, meaning the patient must have tried sorafenib first. And if you're familiar with sorafenib, you know how terrible the side effects are for your patients. And the alternatives to sorafenib are Stivarga, Lenvima, and Cabometyx. And I don't know if those are available yet in your countries, but all of these are now approved for advanced stage HCC. Actually, by show of hands, I'm just curious, are these drugs available, approved in your countries? Yes. Yes, all of them? Yeah? Most of them? Okay, great. But here's the problem I have. None of these drugs are curative. None of them. And most patients on these drugs do not understand this fact. Maybe it's just an American thing, but most doctors in America do not know how to tell their patients they are dying. They just don't tell them at all. And we have to do better, not just for liver cancer, but for all cancers. So for those of you who came in late, I started with a quote about JFK that he said in September 1962 when he was trying to urge Americans to go to the moon. And that's actually the snapshot of that day. And I did the beginning of the quote. Well, now I'm going to do the end of the quote. We choose to go to the moon. We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard. Because that goal will serve to organize and measure the best of our energies and skills, because that challenge is one that we are willing to accept, one we are unwilling to postpone, and one we intend to win, and the others too. Apollo 11 landed on the moon in July 1969. So from the time JFK declared we choose to go to the moon to the time it actually happened was only 7 years. And when Buzz Aldrin walked on the moon, JFK was no longer alive. But he had this vision that inspired a country which invested the necessary resources, both in terms of money and people, to make it happen. So I want to replace the words go to with cure and the word moon with cancer. We choose to cure cancer. We choose to cure cancer by 2045, not because it is easy, but because it is hard, because that goal will serve to organize and measure the best of our energies and skills, because that challenge is one that we are willing to accept and we are unwilling to postpone, and one we intend to win. I also started this talk with my visit to Prague Castle yesterday. And when I look at what they achieved in the 15th century, I cannot believe in the 21st century that we cannot cure cancer. We have too much knowledge, we have too much science, and we have too much technology. I think it's just a matter of we have to choose to do it. And I know one of the problems we have in the United States is we operate in silos. We make it difficult for researchers to collaborate. In fact, we put researchers in positions of competing against each other instead of sharing their research. We need to collaborate. I truly believe there could be a cure for cancer, and I know cancer is not one disease, but many diseases. But I truly believe we could do this in 25 years. And not just in the US, but worldwide. But we need to start talking to each other. We need to work together. We need to allow researchers to share their research, not pit them against each other. If you would like to get in touch with me, my email is andrea@blueferry.org. And please definitely link in with me at Andrea Wilson Woods. Thank you so much.